Alright guys, so I'm going to talk to you a little bit about what I see in the clinic and what I do in the clinic. So single sport athletes who play back-to-back seasons or semesters are at a high risk of developing injuries because of overtraining of similar patterns of movement. This leads to asymmetry of muscles used. There is selective tightening of muscles, uneven forces in joints, and excessive demand of select muscles, in addition to lack of recovery time. These factors produce shoulder, hip, and core syndromes. Upper cross syndrome, also known as shoulder dysfunction, consists of tightness of pec major and minor, upper trap, and levator scap, in addition to weakness of middle and lower trap and deep cervical flexors. This pattern of imbalance creates joint dysfunctions at the cervicothoracic joint and the glenohumeral joint. At the cervicothoracic joint, the vertebral segments move posteriorly, potentially causing disc pathologies. At the glenohumeral joint, there's a decrease in glenohumeral stability, and the glenoid fossa becomes more vertical. Here's a male specimen who probably spends a lot of time working on his biceps, triceps, and deltoids, but the way he's tilted forward could potentially lead to shoulder impingement and rotator cuff pathology. Lower cross syndrome produces hip and core dysfunctions. According to a study by Ladner in 2012, lower body syndrome primarily presents with a weakness of the abdominal wall, a longer lordosis. This causes shift of kyphosis and inability of the hip to propel through full hip range of motion, ultimately resulting in inability of the hips to propel through full hip range of motion. So in order to make sure that athletes do not have these issues, physical therapists functionally screen them. We want to identify athletes at risk. Athletes are performing high-level activities. Many are inefficient in their fundamental movements without even knowing it. Their asymmetries create poor movement patterns. Athletes train around pre-existing problems, and they do not train the weaknesses during their strength and conditioning programs. Best equipment and programs cannot improve performance. Fundamental movement dysfunctions are not exposed. If this weak link is not identified, the body will compensate, producing inefficient movement patterns, causing decrease in performance and increase in injuries. We screen athletes for 4 reasons. We want to identify the weak link in the movement pattern, assign an exercise to correct it, such as core training and reactive neuromuscular training. In reactive neuromuscular training, we want to re-educate the muscle to fire properly in case it's not firing during closed chain activities. We want to assist in program design by systemically using corrective exercise to normalize or improve fundamental movement patterns. So if someone cannot do a squat properly, we want to correct it by putting something underneath their feet. Provide a systemic tool to monitor progress in movement pattern development in the presence of changing fitness levels. And lastly, we want to create a functional movement baseline which will allow ratings and ranking movement patterns for statistical observation. Normal motion does not guarantee normal movement. FMS scores can be improved through intervention. This study gives credibility to the principle that poor movement can be fixed through corrective exercise. Objective screenings help to identify asymmetries. In the FMS, 5 of the 7 tests, the hurdle step, the lunge, shoulder mobility, straight leg raise, rotary stability, observe both the right and left sides of the body. Each movement is graded on a 0 to 3 scale. You're actually better off getting 2 2s or 2 1s versus getting a 3 and a 1, because that's going to predispose you to a higher level of injury or a higher risk of injury. The FMS, the perfect score is 21, and so they recommend that you're no longer at risk for injury at 15. So we recommend discharging patients at 19 and 20 and 21 to further make sure that you're stronger. Running. 70% of all runners were going to sustain a running-related injury. Evidence supports the use of real-time visual audio feedback. Physical therapists analyze running mechanics through phone apps, video cameras, and program measures. Using these feedback tools, physical therapists are able to help runners decrease the force with which their feet hit the ground and improve running form at the hips, knees, and ankles. Through visual and audio feedback, runners can see themselves in the mirror or their videotape while a physical therapist corrects their form. Through audio feedback, we tell them to increase their cadence, or they can even use a metronome to do the same thing to get it to about 90 steps per minute. And lastly, we cannot not talk about runners, we cannot talk about athletes and not talk about the core. In a 2007 study, 277 collegiate athletes were tested for trunk displacement after a sudden force release. The examiners looked at the subjects, they looked at their trunk sway forward to back and side to side motion. They recorded the data at 150 milliseconds and maximum sway. After 3 years, 25 were injured. What they found was the decreased trunk neuromuscular control compromised dynamic knee stability. Trunk displacement was greater in athletes with knee ligament ACL injuries rather than uninjured athletes. And lateral displacement was strongest predictor of knee ligament injury. So when they would trunk lean to the side, that could be a big predictor when you see your patients do that. Ultimately, core deficits accurately predict knee ligament and ACL injury risk. Another study looked at functional stabilization training on pain, function, and lower extremity biomechanics in women with patellofemoral pain, who typically present with hip adduction, knee abduction, and ipsilateral trunk lean. The exercises they used for the functional stabilization included a single leg squat with the band around the knee, so you have to fire the knee out, a lunge with the band around the knee, you have to fire the knee out, as well as planks, and they gave them a lot of feedback while the patients looked into the mirror. What they found was intervention of hip strengthening and lower limb and trunk movement control is more beneficial than a program of strengthening alone. The importance of neuromuscular system as it pertains to the core has been clarified through research specifically addressing muscle activation patterns during sports activities. It's been demonstrated that in the response to rapid arm movement, muscle activation patterns begin in the lower extremity and proceed upward throughout the trunk and to the arms. This pattern of force development from the ground through the core to the extremity has been shown in tennis, baseball, and kicking activities. The athlete demonstrates alternating patterns of joint stability and mobility throughout the body that serve to enhance functional activities and efficient performance. I have a lot of athletes who come in and tell me they have a very strong core because they can do 600 sit-ups a day. Well, let's debunk the myth of the sit-up. The role of the core of the abdominals is not to contract and to compress, but to contract and lengthen. And this last study supports that. This particular study looked at two types of trunk exercises on balance and athletic performance in youth soccer players. They assessed standing on one leg, doing star reaches, so bringing one leg forward, side, and back, stable standard balance, and also their endurance was assessed as well. The exercises they used were conventional ones versus stabilization ones. The stabilization exercise program was composed of 4 exercises: the front plank, the quadruped, the back bridge, and the side plank. The conventional ones, which are your crunches, consisted of 2 different types of sit-ups, back extension, and 2 different back extension exercises. What they found was that the group that performed the stabilization exercise did better throughout their single leg balance, dynamic balance, as well as in their endurance tests. And so ultimately, stabilization exercises are more efficient and better for treating athletes. That's it.